friends, I am Dr. Rahul Bhargava, Director of Hematology and Bone Marrow Transplant at Fortis Memorial Research Institute, Gurugram. And today we are going to talk about very special, interesting topic of autoimmune hemolytic anemia. What is autoimmune hemolytic anemia? As the name suggests, autoimmune hemolytic anemia. It means blood is getting destroyed because your own cells have started recognizing your cells as terrorists, and that's why they are killing. Very simple. Why they have become terrorists, we don't know. We don't know who will develop, but what we know is how to treat. So typically the patient presents with jaundice, which is indirect in nature, low hemoglobin and the retic counts being raised. That's how the patient presents to us. And the simplest test we need to do is a CBC and reticulocyte count. The retics will be raised and the DCT, direct Coombs test, will be positive. So once the direct Coombs test is positive, we know it's autoimmune hemolytic anemia, and that is why we need to give steroids. So how do you diagnose autoimmune hemolytic anemia? Is very simple. Increased retic, increased indirect hyperbilirubinemia, means bilirubin has got two fractions, direct and indirect. Look at in your reports. So if the indirect fraction is more, it's called as hemolytic anemia. High LDH, high retic, low haptoglobin, and yes, the diagnosis is settled. So along that, what do? You do a ANA test, anti-nuclear antibodies, just to know in females that there is no autoimmune disorder which is going on. And once we know that, we give steroid for 4 weeks and taper it next 2 weeks, and the patient becomes better. 70 to 80% people will become better, but they have a relapsing remitting course, and that is why you have got 8-9 medications like rituximab, cyclosporin, MMF, vincristine, azathioprine, splenectomy operation, and daratumumab, which can all be utilized in these patients. So what is more important is to diagnose it early. And of course, in the elderly side, above 60 years of age, if you find an autoimmune hemolytic anemia, please do get a CT chest and CT abdomen and a bone marrow test, so that you don't miss any malignancies or hematological malignancies. And this is what we require to be done. So this is purely a benign hematology. Need not worry, it is very catastrophic, it comes very suddenly. But don't worry about it, and stay tuned and join us to know more about hematological malignancies. Thank you.